What are dermal fillers? Are you having fillers or considering to have them for the first time and you are scared, you don't know what to expect? Well, hi guys, my name is Dr. Nina. I'm a cosmetic dental surgeon and an aesthetic physician. I work in central London and welcome back to my channel. Today I'm gonna give you tips about what to expect and what to look for if you're having fillers for the first time, or even if you are having filler for a while, this is exactly what you should know. So dermal filler could be temporary, semi-permanent or permanent. Recently, as physicians, we have been moving away from permanent fillers because it's much safer with much less risk just to do temporary fillers. Personally, over the years, I now moved mainly to hyaluronic acid based fillers, commonly known as HA. The reason being is that those fillers last on average between 6 and 12 months, and then our body will progressively completely break them down. So they are much safer. Furthermore, in case a complication happens or in case you're unhappy with the result, we actually can dissolve them with a specific enzyme. Now, which areas can be treated with dermal fillers? Well, I'm actually going to show you exactly what you can have done. So, starting from the top of the face, fillers could sometimes be injected only by a very experienced practitioner in the forehead. The reason why we normally stay away from that, because it's quite a risky area where we can risk something called vascular occlusion, but I'm going to the complications later. Other areas are the temples, which unfortunately they get more hollow as we get older. Very common area is called the tear trough or the under eyes area. So this area here as well, as we get older, unfortunately this bone support here retracts and we develop sunken eyes. Cheekbones, one of my favorite treatments. It really helps to give a beautiful lift of the face. Lips, absolutely, and then mandibles, so jawline and chin fillers. So, what to expect when you have dermal fillers done? So, what we normally recommend, as in the face there are so many blood vessels, is for a couple of days prior to having fillers not to have any alcohol. That will minimize the risk of bruising. What to expect afterwards? Well, very common side effects are swelling and bruising. Absolutely normal. So if you have an event to attend, I will highly recommend not to plan anything for a couple of days afterwards. We can go into more serious risks. So the most serious risk with having dermal fillers injected is blindness. So we have to be open about it and mention it. So blindness with dermal fillers is very rare. However, there is a small risk. The highest risky areas of injections are the nose, the forehead, and these are here called the glabella. Then also the lips and the nose to mouth lines as well. Another serious side effect or complication is something called vascular occlusion. What that means in essence is that once I inject the dermal filler, which by the way it looks like a gel, this is how the hyaluronic acid dermal filler looks like. So it's a pre-filled syringe that we open, we attach a needle. Once we push the syringe, the hyaluronic acid comes out into a gel form. So the thickness of the bleb left from the syringe varies based on which area of the face we are going to inject. For example, if we are going to inject areas like the under eyes or the lips, then we want to use a thinner filler. Whether if we are going to give volume to the face and really give definition and lift and contour, in those cases such as the cheekbones and the mandible and the chin, we want to use a thicker filler. Also, the other complication that we have is a vascular occlusion, which means once we inject the filler, there's a possibility, there's a chance that that filler can block a blood vessel. Again, it is rare, but it can always happen regardless of how experienced the doctor is. It's a risk, it's a complication. In those cases, what happens, we need to dissolve it straight away, because if we don't, that can lead to something called necrosis, which means if the tissues of the face, if the skin doesn't have enough blood supply for a while, then eventually can die. So the good thing about it is that it is reversible, and that is why it is so important that you have dermal filler treatments done by a qualified medical professional. So you want to go to a doctor, dentist or nurse prescriber, because only those categories of people can prescribe the enzyme called the hyalase that can dissolve the filler in case a complication happens. So I hope this was helpful. Please don't forget to subscribe to my channel, and if you have any further questions, I'll be delighted to help you. Thanks for watching.